Hi, I'm Dr. Lindsay Coble.
Dr. Noelle Crosby, and we're the Sound Sisters, and this is the Hearing Diaries. And today we are thrilled to have a good friend and colleague of mine on, Dr. Judy Huch. And Dr. Judy Huch and I have known each other for quite a few years now. We're in Theos together, so I know she has so much to offer us. No matter what she decides to do, she does it full on. Yes, yes. So today she is going to talk about some of her expanded clinical work that includes mind-body training. She brings a whole person perspective to hearing healthcare now, and she's using this now in lots of different aspects of her work and her life. It helps patients to better understand the connection between stress, the nervous system, and how we experience hearing, tinnitus, and just life in general. So welcome, Judy. We're so happy to have you here.
Well,
Um,
thank you for bringing me on.
Judy, tell us a little bit about how you just got into audiology to begin with. What originally drew you to the field?
Uh, you know, I wish I had some aha moment, but it was just taking the next right step. And because I had no dreams of really being anything growing up. It was just expected that you do something. And so through circumstances, I had a roommate say, just go to this intro to speech path and audiology. I think you'll like it.
Oh,
And
that's
I
funny.
did. And, but I loved the audiology more. Um, and then it just kept going. I thought hearing aids were evil incarnate. And then I found I had a gift, with talking with people. And then it was more, I don't want people to tell me what to do.
Oh,
So
I can
private
see that.
practice. Yeah. So welcome to private practice. So you can, stay up hours upon hours at night. I have gotten over that, as Noel
Oh.
Oh
can
yeah, we know
testify.
Judy's got strict bedtime.
8:30, have
That's
my
it.
Irish
Nothing
goodbye.
scheduled after that.
Um, but it's just been a series of, gosh, let's just try this next.
I
Because
love that
failure
though.
has um, never been a word I've been afraid of.
Well,
I
I
love
love
that.
that.
Yeah,
That's
I do
even,
love that. Failure's never been a word I've been afraid of. I like that.
yeah,
I feel like a lot of entrepreneurs just kind of live by that, but we don't even recognize that saying that you just said. I love that. So I'm
Yeah.
excited to learn about your mind body work. So, at what point in your career did you start noticing that some patients needed more than just traditional audiology?
Well, it was really changes in me. I've been in the space since 1991, so I've seen the evolution of change. And honestly, the patients say the exact same thing of their challenges um, from back to 1991. And that
how many years
was,
later, right?
yeah, and that's a little frustrating. And so about 20 years into my career, I just I just was unsure that I wanted to do it anymore. I wasn't fulfilled. I was frustrated.
Now, were you
I
in private practice then, or were you in a different area?
no, in 2026 is going to mark 30 years in private practice.
Oh my God.
Um,
Okay.
and so no, I did that very early. I only worked, if I count my internship, I only worked under three people um,
Okay.
in
Mm-hmm.
my career. So, and they all have been instrumental in helping me become who I am. But
Mm-hmm.
um, most of that challenge was around hearing aids. That, gosh, there just has to be more. And you know what? There's something huge, and it's the brain, uh,
Mm-hmm.
because we have ignored the brain for so long. And um, but just finding that deeper connection with people. And honestly, this was right around the time that I found in Theos, and it was my
Okay.
philanthropy work and
Mm-hmm.
um, finding different ways to connect outside of audiology. Um, And that's when my journey really exploded, I guess. And I
Mhm.
started to dabble in so many different things and just to see what would stick. But I learned a
Yeah.
lot along the way.
Mhm.
Oh, I can see that. Like you're always doing something. But was there like a particular patient experience or a personal moment that just sparked your interest in maybe this would be a tool that could help me address those concerns or those frustrations that you had with your hearing aid patient?
Well, I met Sarah Downs, and she taught me quite a bit, and she brought up this um, mind-body medicine course. And so, of course, I signed up right away thinking that I was going to be helpful to tinnitus patients. We do auditory processing out of our office as well. Um, and the funny thing is, the healer has to be healed first.
Oh,
Um,
yeah.
and so I'm very open with it, but I have a lot of PTSD. I have a lot of anxiety in my life, things from my childhood that I've had to deal with. Um, and this truly opened the door, and helped me bring the other things that I do in my
Mhm.
life, at this pivotal moment. And then my counseling started to change. Um, Even if I had 5 minutes with somebody, I was able to help them regulate, and kind of see that they can't think themselves out of fight, flight, or freeze.
Mhm.
We have to use our body, to tell our brain we're safe. So, but it was very transformative, taking those courses.
And what were those courses in case are they still available out there if someone's interested in them?
Yep, the College of Mind Body. Um, I'm going to put that
We can put it in the
in the,
description
Yeah,
somewhere.
that is
Yeah.
someone
yes.
will.
Okay. Yeah, we'll look that up.
Yep,
Perfect. I'm sure
because
others would be interested in that.
there are three different courses that you can take. The first one's always for yourself, always. And there's
I
five
think I want to take it.
modalities that
Mm.
they do. And the second course is to help you teach others. And then you can become certified to certify others.
Mm.
Okay.
Mhm.
That's the last step that I haven't done, but I can teach people, but I can't certify others
Mm.
as of
Neat.
yet.
Okay. Neat. When
Yeah.
you're working with your patients, how do you explain to them this mind body experience that you want them to be accepting of or come around to? I mean, obviously, you don't probably come out that forwardly and say it, but how do you explain it to a patient?
Well, kind of, I do, mostly because I have no idea how to beat around the bush. I have to be direct.
Yeah.
Um, but it's, have you guys have taken like Clifton Strengths or like the disc and
Yes,
things like that.
profile. Yeah.
So
Yeah.
on Clifton,
I don't think I took Clifton. I'll have to
Mm.
learn more about it after.
well, there's one, and I think because you and I, Noelle, complement each other in many things. And so, like, there's one that's called Woo, and it's kind of like the cheerleader,
Mhm.
the influencer on disc.
Mhm.
Um, that's always dead last with me.
Uh-huh. Mhm.
Um,
That's
and I
funny.
always
And
say
it's
I'm not
first
into
with
woo.
me.
Yeah, it's first with you.
I'm the big woo
Yeah.
woo.
And so because I work with a lot of military
Mhm.
as well. And so I just say, I'm not into woo, but um, like I had said before, you cannot think your way out of like a panic attack
Mhm.
or when you're starting to feel anxious, or, my two worst places is the grocery store and the car. Um, and you can't rationalize yourself out of that.
Mhm.
So you need to use not only top down, that's your brain on the executive level, but also bottom up. And that's really your heart, your soul, um, your being in the center of you. And that it takes you to a different level where then your body tells your brain, you are safe.
Mhm.
This ringing doesn't um, isn't going to take over your life, and that's just a series of guided meditation, guided imagery, movement,
Right.
um, and a lot of breathing, a lot of breath work.
Mm-hmm.
Um, and they have to choose it. So I give them a choice at the beginning too. There are reasons to keep your tinnitus where it's at, and there are reasons to make it less intrusive in your life. And honestly, there are people
Yep.
who will keep it. And
Because it
we have
almost
to be,
defines them in a way, or it's become to define them.
yeah,
Mm-hmm.
yep.
Yeah.
Auditory processing, same way.
Oh, really? Interesting.
Yep. Um, and I had somebody close to me who had misophonia, um, debilitating misophonia. Same thing. They had to choose.
Mm-hmm.
You
So,
have to choose. It's making
yep,
that
Yeah.
choice. I love that. Making a choice for you versus whatever that is that you like that defines you, but not necessarily in a
Yeah.
good way. Very,
Like
it's
letting
so
control of,
interesting.
yeah. So
Yeah.
interesting.
So how does the nervous system influence the hearing, tinnitus, and sound tolerance, and maybe even auditory processing?
It's um, at the end of the day, really what it comes down to is what are they anxious about? What is the anxiety? Um, and you have to dig down into that because once we're anxious, our cognitive load declines, right? And then that's where auditory processing can become even worse. Or our sensitivity to things, phonophobia, um, they can become isolated. You, there are a whole host of things, but at the core of it is something that they're anxious about,
Mm-hmm.
fearful of, and you can never brush that under the rug. And also, as a clinician, making sure that it's something that I can handle. So, having that team of other mental health providers or neuropsych, um, for us to refer to is important. Um, but to get them comfortable enough in our relationship to trust me enough for us to dig into that anxiousness and then I don't want to say breathe it away, but almost breathe in love and breathe out the control that it has on you.
I love
Um,
that.
so
Yeah.
that's what we boil it down to.
Yeah.
Do you
Well, it
see
sounds
common
Lindsay, it's
patterns? Oh, go ahead, Noel.
I was
Go ahead,
just going to
Noel.
say it's a little bit like what Jennifer Gans was saying with her
Mm-hmm.
mind body
Yeah.
program too.
Mm-hmm.
That it's just so interesting that so much gets down to that one piece of fearful and anxiety,
Mm-hmm.
and
Yeah.
so many
Similar.
choices and decisions we're making are based on that.
Mm-hmm.
Yeah.
I was just going to say, Judy, do you see common patient patterns when you can like sense that this person is anxious about something and they need to let it go? Or do you find that it's really hard to read a patient when they come into your office and you have to really dig into that a little deeper?
Well, um, whenever anybody talks about not understanding speech or the ringing in their head or the roaring or whatever,
Mm-hmm.
you can feel and see it just as they're talking to you.
Yeah.
Um, and if it's a tinnitus patient that needs, heavier counseling, because I don't always see them at the beginning. I have other audiologists that do the tinnitus function testing and, all of that. So I'm more higher level. But um, it's also, I'm in a unique position of um, trust anyway, because especially with my military
Mm-hmm.
people, even though I've never served, my dad did, my brother did, my son did, my nephew did,
Mm-hmm.
uncle-in-laws. So I can connect with them. And I've worked in this field with military since 1997. So I have that connection and I let them know how honored I am to hear their stories. Um, so we do get into some
Oh, I
very
love that.
heavy, heavy things.
Mm-hmm.
So in that few minutes, even if I can show them two or three ways to breathe, that gives them that first step. Um, because sometimes I only have 5 minutes with them, and this is for my compensation and pension exams. And
Yeah,
yes, I know that I'm not supposed to give treatment advice, but
you're right. In
Well,
your
we
five
won't, we'll
minutes. Yeah.
redact it.
Uh-huh. In your 5 minutes that you get.
yep, but I do a bunch in that 5 minutes.
Uh-huh.
Yeah.
Neat.
Oh, so how does mind-body training work alongside your evidence-based best practice audiology care rather than replacing it? How do you meld it together?
Well, it gets them in a better space to be ready for it. Like if I have to go through TRT, and some of the things are not that pleasant at the beginning, and it helps that they're not fighting you. And also with my guided meditation, like I'll pull things when I'm coming up with a script, I'll pull things from um, like pain management.
Mhm,
Um,
mhm,
and it's really because we have to acknowledge it, we have to accept it, we have to name it so then we can have more power over it
mhm,
instead of it having the power on us. So once we get to that spot, then my sound therapy is so much easier. It's easier to speak with them because we're in a space of regulating our nervous systems together. I'm
mhm,
the catalyst to help them be more calm. And so there's not as much defensiveness. The walls are down. Um, and it's just so much easier to get to the other things because that communication line is so much better.
mhm. What does, I'm like envisioning you doing a counseling session with somebody.
Right.
What does it look like in clinical practice in your office? You mentioned your other providers do see tinnitus patients, but you're a little more higher level. Once they get to that type of appointment, how do you structure it? How long is it? Is it multiple appointments?
And it's usually multiple appointments. And one, we offer Odo, the
Mhm, mhm,
app, which goes in line with what I do in clinic really beautifully as well. And so we always start with our breath, always. Um, and I can incorporate that into guided meditation or just it by itself. Depending on how we're structuring it, like if I have to get them to where they're going to accept things first, we might do an exercise on movement. Um, and we may put that more at the back because most of us have a hard time with movement in front of others.
mhm,
Um, we have such a self-awareness problem.
mhm,
Um, but guided imagery, that might be something that just draw a picture of where you're at in your life, right now. Um, it could be stick figures, it could be abstract, whatever. It's not an art class.
mhm,
I'll do one at the same time. And then what is your tinnitus preventing you in doing in your life and draw that.
mhm,
And then the last one would be what is it going to look like when you have overcome
Oh, I
this
like that.
challenge with your tinnitus? And so they can see this. Um, and it'll be a little bit different each time. We also do, sound therapy, and that might be 10, 15 minutes of just listening for them to help regulate their own nervous system as well. So um, I, I call myself Hellenistic in the approach that I just pick a little bit of this and
mhm.
that in my big bucket of tricks.
Yeah, it's a
Love that.
tool that you have.
Yep.
Mhm.
Yeah. Well, what patient population tends to benefit the most from it? Do you find younger, older, regular hearing aid patients? I'm sure tinnitus patients are the ones that you use it mostly on, but yeah, can you
Well,
say
we're
anything
working
about that?
into the sound safe protocol is what I was
Okay, I heard about
also
that.
thinking of, um, is that we are branching it into our auditory processing
Mhm.
population, and we do see a variety of children to adults. Um, and really it'll benefit anything. I'm even thinking if I ever have grandkids, like I'm going to start working with breath work and all of that because it helps with our anger, our frustration, our anxiety, and why not give everybody the tools as soon as
Yeah.
possible?
Mhm.
Oh, I think, I've seen some little kids that meditate and, and then they're able to talk about their feelings like that and use their breath or use um, their grounding or things like that. And I just feel like kids are so much better off when they have those tools. So I love
Mhm. Judy, do you
that.
have your office set up do you have a tinnitus room that's more zen or than just a regular clinical room, or is it very a desk and clinical in nature? I'm totally just curious.
It's a little bit of both. Like
Uh-huh.
in August, I had a flood in my office, and so we had to redo a couple of treatment rooms. And so I've started to incorporate color,
Mm.
and so I've really
Hmm.
researched the types of colors that I
Neat.
can use. So, and I also have one of those little Oasis mini where the sand art
Oh, yeah. Hmm.
that's in that room. Um, and I'm taking each of our rooms, and like this one will happen to be like Asia. So with my philanthropy work, we're going to
Mm.
have
Oh, I love
Nepal,
that.
Yeah,
um,
so neat.
Jordan, and so yes, trying to make more of those calming things because it was a trip to Nepal that also anchored all of this. This is my tattoo. There is, the Om.
Yep.
Um, that's that's Om in Tibetan, and that's just to help me remember. So I want to reflect that in each room.
So
Um,
neat. Hmm.
there's still an audiometer, there's still a booth.
The
So
necessities, but
yeah.
kind of zen. Oh,
Yeah.
I love that.
Yeah. Well, let's switch over to the topic of audiologists who are maybe considering adding this in, but they're still a little worried about whether this is their lane, like how much should they offer patients in terms of the mind-body techniques. And so how would you approach it just in your office, explaining why you feel like it's important?
Well, you know, whenever I hear something, stay in your lane or that's not your lane, or um, it's almost like I get so frustrated because what are we going to do? Continue to ignore,
Mhm.
these areas of tinnitus, hyperacusis, misophonia, auditory processing, all of these things that we have argued about since,
Yes,
you know,
and
bef
no one was addressing.
before our time, right? That it happened. And yeah, I was taught by a lot of the people who were kicked out of ASHA. So yeah, that I'm a bit biased on the pathway, but I've been in this space for so long that I'm just tired of that BS. And um, and see, I'm curbing my language because, this is more in the public domain, so I'm being as good as I could be. But what we have to do is we have to get our teams ready in our office, right? Even if you're a team of two, um, you still have to get everybody on the same page to try this out. Be curious. My goodness.
Be curious.
You
Noelle's
know,
favorite line. Hmm.
see right up here. This is my
See?
Ted Lasso shelf.
Love
Yeah.
it.
That original thing did from Ted Lasso, I realized.
Oh.
Be curious, not judgmental.
Mhm.
I just love that.
Yes. And so he's, and I got to go in London. I got to see the whole
Oh,
Richmond area. That'll be another talk. But and stay, get out of your own ego.
yeah.
It's because our ego tends to drive us a little too much, I would say. Um, and find ways to help your patients. Um, y- the people that I admire the most in audiology, they have driven their own path. They have um, not gone with the flow. And kind of in a way, I want more of those disruptors in our
Yeah.
field because some of the voices have been stifling.
Mhm.
Um, Okay, so my cat just behind me. Oh no, they were fighting or playing. Um, I-
Just
two
playing.
black cat, yeah, two black cats, and I have a black cat on my shirt.
It's all in theme. All in theme.
But, um, but really, just stink and do it. If I could just push. Okay, I'm sorry, we may have to edit that part out. Um, we just have to do a better job for our patients.
Oh, I love that. Just be willing to do what you need to do to help your
Mhm.
patients and not worry about what other people are saying that aren't doing as much of a job to do that.
Right. And have your team behind you. I'm not
Yeah.
Mhm.
saying
And have the
that
training too. Like you
yes,
took
Yeah.
yes.
training. It's not like you're just decided, oh, I'm going to be this. You actually took training to learn
Mhm.
how to do it
Or refer out. Know when to
or
refer out
refer
and
out. Yeah.
Mhm.
quit being threatened over that.
Mhm.
So,
Mhm. Mhm. Judy, do you have any other good resources for young audiologists or audiologists interested in this in general? Like you looked into that College of Mind Body to get that certification. Where else would you look? I mean, I'm thinking
well,
like yoga, understanding yoga and meditation and
Yeah.
things like that are probably an avenue that could totally benefit our patients.
it does. So yoga and Pilates are actually on my list of things to do. And part of that is because um, our breath is really
Mhm.
important in both of those. Um, it, getting out in nature, um, just
Yeah.
even touching outside, getting real light, um,
Mhm.
movement, and um, also just even taking 5 minutes a day of finding the glimmers, the gratefulness,
Mhm.
because we have to rewire our brains for good. Um,
Yeah.
because it's pre-wired for bad.
Yeah.
Um, and so those are just muscles that we need to flex. And then once you start working on that self, that yourself that way, and again, I'm not woo, but that energy is still going to attract people, um, with similar love or calmness.
Mhm.
Um, and, because I'm anti-drama. So
Mhm.
I want to find the love and calmness in other people
Mhm.
too. Um,
Mhm.
and move with them. But, there
Mhm.
still can be a lot of fun. I'm very quirky, but um, also don't be afraid to look outside of audiology.
Mhm.
Yeah.
We can learn from the dentistry industry, ophthalmology, just all of these other places. Um, I
Yeah. There's a
learned,
lot of teachers out there.
yes,
Mhm.
yes.
And you know the saying, when the student's ready, the teacher appears. So you start thinking about that. You
Mhm.
want to learn about this, and I'm sure you could find YouTube. I am sure books. Like there's so many resources that
Mhm.
people could find to learn more about this, I feel.
Yep, yep.
Yeah, love it.
And it is kind of searching it out, but also be mindful on what is the background. You don't want to just follow an influencer or something like that. You want to
Mhm.
make sure, like Adrian Yoga, and Noelle, you and I have talked about that for
Yeah,
quite a bit. You're the one that got me started on her.
yeah,
Um, and I still watch her and
yeah. I do her flow. I like that's been a few seasons ago, but I still love that.
yep.
15 to 25 minutes, perfect timing. Literally, it will be sometimes the only time in my day that I am willing to disconnect. And
Mm.
sometimes just me going in my room that I do my yoga in and putting my phone down and
Mhm.
saying, I'm starting. Like sometimes it takes me 15 or 20 minutes just to be able to
Just
do
to
that.
start. Yeah.
And then once I do it, I am not connected to anything and I'm just doing my yoga. It's probably the best thing that I could do for
Yeah.
my busy, crazy mind, you know?
Mhm.
Yeah. So that is so, it's so hard to do, but it's so worth it. So let's do a couple takeaways and a little bit of a closing with this topic. I know there's so much more that we could discuss with it, and so much more just to talk to you about. But what's one takeaway that you hope listeners will walk away from after having this conversation?
Well, work on yourself first, to be curious. When I was reflecting on this journey is the older I get, the more I fall in love with myself. Um,
Mhm.
and
And then
and
other people are falling in love with you because you can hear that from you, but you don't care. You know, that's not your main reason for doing it.
exactly, see, and of course, there's some selfishness into it, but I think the takeaway is that you are strong, you are worthy, you are badass, and just allow your inner self to heal and grow, and then you can heal and grow with others.
Oh, I love
So
that.
good. I think let's do
Yeah.
a rapid fire. Are you ready,
Yeah.
Noelle? All
Yes.
right, here we go, Judy. What's one word that describes you and why?
Sassy.
Ooh, I like that.
Sassy.
Yeah,
She's
that's a
a
good
sassy
one.
girl.
Bring the fire.
And why? Because I am never what you expect.
That's very true, Judy. The time since I've known you. Yep. Just when I think I know you, something happens and I get to know a different little piece of you. You make it interesting, which is lovely.
Thank you.
If you could master any new skill overnight, what would it be?
Gardening.
Oh,
Ooh,
that's
me
one of my
too.
favorite things to do. I love
So
to
it
garden.
is. I'm not
I
good
love
at
watching my plants grow.
it.
Yep.
Where
Just
do you
start with
see?
one plant,
Oh,
Judy. One plant.
Oh, I've killed so many. Rick's mom gave me a plant. Now I got this when Rick was born,
oh God,
so just
keep it
take care
alive.
of it.
Dead.
Sorry,
Yeah,
sorry. Not
whoopsie.
here. Yeah. Where do you see hearing healthcare in 10 years from now?
God willing, autonomous.
Love that.
Yep.
Love
Waiting
that.
for that for just a few years, right?
Mhm.
Oh my
Uh,
gosh. Yes, if anything out of my career, I want it to be that.
yes, yes. I'm going to keep working until that happens. So I may be very old when I retire. I don't know if you drink coffee, but any kind of drink order that gets you through a busy day.
Caramel macchiato.
Oh
Oh,
yeah.
okay.
What is a sound that makes you happy?
Oh, child laughing.
Oh,
Yeah, cute.
that's a good sound. And if money wasn't a concern, what would you be doing? Kind of feel like I know this question.
Same frickin' thing. Same thing,
Only
but
on a bigger scale, right?
much bigger. And so I'm just going to say if I win the lottery, there
Look
will be
out.
signs.
Look out. Here comes Judy. Love it. What's one thing our profession could do better, either for patients or for each other?
Be more curious and graceful with each other.
Yeah,
Mhm. All the
so
way around.
many of our guests have said that, Judy. Yep.
Hmm.
Yep.
So finally, and we've talked about this a lot today, which B fits you best? Be kind, be brave, be curious, be bold, or be happy. I feel like all of those could be
Hmm.
you.
I did struggle on this one a little bit. But again, what started me on this journey is learning about kindness. So be
Hmm.
kind is going, um, because the
Yeah.
journey of being kind is not nice.
Oh, I loved that. That
Yeah.
taught me so much. Be kind, not nice, because being nice is not always being kind. But
Mm, I
yeah,
like
you
that.
taught me a lot about
Never
that.
heard
So
that. I
thank
like
you.
that.
Yeah,
Yeah. Yeah.
so
We
interesting.
we be nice for
Maybe we'll have
ourselves.
to have you back
Hmm.
on to even just talk about that difference, because I think so many of us don't understand it. We got a lot
Mhm.
of things to talk about.
Lots of that.
Yes. Well, Judy, thank you so much for sharing your perspective about this particular topic and reminding us that hearing healthcare is deeply human. I think we forget that sometimes.
Hmm.
We appreciate the way you're helping clinicians and patients alike to see the whole picture. And I can't wait to see what else you're going to be doing as you move forward in your career. And then we also want to add our Be Curious segment that Judy and Laurel Gregory just recorded a show for Audiology Online, a show, I guess a course. And it's called Bridging the Cultural Gaps. And Judy, just say a little bit about what it's about, and people can go on and listen to that.
And also in being curious and non-judgmental, we
Oh,
do talk about what bias and unbiased perspectives in our lives can
I love
prevent
that.
us from helping, with our patient populations. And so the initial responses were astronomically good, um, with no judgment. That's, I
No
think, the
judgment.
biggest thing that we need to do when we work with ourselves, um, is just don't judge, just do the next right thing.
Yeah,
Love that.
gosh, such good stuff. Oh, we appreciate it so much, Judy, and I can't wait to learn more from you over the years. So thank you.
It was
And
so nice
thank
Thank
to
you,
you.
meet you, Judy.
everybody.
Yes, and Lindsay, I hope it's just the first of many.
I hope so too. Anyway, thank you all for coming on and for being here today and watching the Sound Sisters, and we'll see you next time.